what I tell people with physical activity is the goals are 30 minutes if you're not obese. Obese is a BMI of 30 or greater, an hour a day if you're obese, which is 30, BMI of 30 or greater. So for physical activity, I think of it as, I think that the health coach should basically go off of what the recommendation of the physician was. I think the physician should set a goal of time and frequency, and that usually is either 30 minutes a day for most, if not all days, or an hour a day for most, if not all days. But I think that should be up to the physician. When the health coach engages the patient, it should be for to express a couple of ideas. One is that starting at that goal is unrealistic for a lot of patients. There's a lot of patients with obesity, with joint problems, with claudication of the limbs, and walking that far would be painful. And so the idea that you can start off very slowly with 5 minutes a day and then build it up in 2 weeks to 10 minutes a day, and then in a month to 20 minutes a day, and then in 2 months to a half an hour a day is an important concept to convey. The idea of gradually increasing the dose of the activity that's done and the amount of times a week it's done. The next thing that is important is to not have the gym as the holy grail. Like when I get the membership to the gym, or I'm going to go to the gym and I'm trying to go to the gym more often, but to really sort of say, okay, I go to work every day, I'm going to exercise every day. So something to embed the activity in how their life already works. So if they are driving to work, to find a place that's 15 minutes, a parking spot 15 minutes away from their office, and park there and walk the next 15 minutes, and then they'll have 15 minutes to walk back from their work. And to think of exercise as accumulating throughout the day. So it's not a 30 minutes at once, but they can walk upstairs and count that as 3 minutes, and walk upstairs again and count that as another 3 minutes. To have the overall goal of getting that time. And if in inclement weather, to think about going, if it's too hot or too cold or too wet, to think about going to a mall to do walking. The less the barriers are to doing exercise, and the more sort of part of their day it is, and the more routine it can be, the better. So if they have to get in their car and drive to a gym, that's an addition to their life. If it's just merely a process of how they get to work, or a process of how they go between floors where they work, it's much more likely to be within their grasp to continue. Also, I think it's important if they can engage somebody else in their life, like on lunch break, you and I, let's go out and walk for our 30-minute lunch break. The more they can get somebody else who counts on them and who they can count on to do that activity, the better. I think that's all I have to say.
I think those were good things. I will also ask them, what are they doing now? Sometimes they may tell you, I've been doing, this, and you can encourage that. Encourage them to do it a little bit more. And I had something and a resource, and I have to find it and see if they still make it, on chair exercises, because there are some people who truly cannot do a lot of exercising, but they could still move their arms, and potentially stomp their legs in the chair. So sometimes, if they have that issue, being able to provide resources so that they could still do exercises, it still works, but in a chair. If they can't get out of the house, then it slaps around, maybe the dining room table, to kind of encourage that. And if people are saying things that are probably really strangely inappropriate and they're kind of fixated on that, then, it may be, as you as the health coach, and as you're trying to set goals, maybe then checking back with the physician, like, I'll double check with that and we'll get back to you on what you should do. Because there are people who, for example, they told me they had back problems and they were going on about how they were going to use a stepper, and I think they had knee problems as well, and get back on this treadmill, and it didn't matter about their knee and their back because they were going to do this. I'm like, you don't want to make your other health conditions worse in the process. But sometimes they have that, that idea really kind of fixated in their head, or, they have this idea, water exercise is really good. It is, and you don't feel it till you get out of the water. So if they're telling you something that's really strange, like you haven't exercised in 40 years, but now you're going to go, walk around the pool for an hour every single day, probably not a good choice, on their part. Um, so I think most of people, at least when I talk to them, have an idea of, potentially what they could do, but sometimes they have this really unrealistic expectation in their head, and sometimes actually trying to steer them away from that expectation is a lot harder than, motivating them to do some exercise, or even, stairs in their house if they're capable, things like that. Like you said, kind of building into the things that you already do.